Join us now for Health for Life, brought to you by Hamilton Healthcare System. And welcome to Health for Life. Today we're talking with Dr. Hector Dourron of Hamilton Vascular Center. They have two locations, one in the Medical Arts Building on Burleson Road in Dalton, the other inside Hamilton Physician Group Murray Campus on GI Maddox Parkway in Chatsworth. Thank you for joining us today, Dr. Dourron.
Glad to be here, Bobby.
Dr. Dourron's a board-certified vascular surgeon. He is bilingual, speaking both English and Spanish. Dr. Dourron, how long have you been with Hamilton?
So I've been with Hamilton for the last 3 years now.
3 years.
Yep.
Fantastic. Now, why did you choose to become a vascular surgeon? Of all the things you could have done.
So my training, we're actually board certified in general surgery and vascular surgery. So it's in order to become a vascular surgeon, you have to become a general surgeon first. You get an exposure to all the different subspecialties within surgery itself, and vascular is really what piqued my interest. It was very technical, and you get to work on a lot of different parts of the body, so it was more intriguing to me.
Okay, I understand. But what I don't understand, what is vascular disease? What is that?
So vascular disease is diseases that encompass pretty much anywhere the blood flows. So it can be in arteries, it can be in veins, and we also do deal with lymphatics as well.
Lymphatics?
Lymphatics.
Now, what is that?
Lymphatics are basically, they're like blood vessels that carry the waste product of muscle. So if you think of muscle as a factory, factories have waste that they produce, and that waste needs to get carted away. So that waste goes through what's called lymphatic channels, and then it goes through the lymph nodes and gets cleared up, and then it gets dumped back into the circulation. So people who, for example, have lymphatic problems oftentimes come in with leg swelling, which also can be confused with venous disease. So they all pretty much come in with similar symptoms.
Now, do people have that sometimes, but not always?
Correct. So some people will have lymphatic disease. You're talking about lymphatic disease,
yes,
correct?
Absolutely.
Okay, yeah. So some people will have lymphatic disease. For example, if they acquire some kind of virus, they get an infection or something, then it can clog up these lymphatic channels, and that will cause swelling. They get treated with different massage therapies and compression therapies, and that can improve.
Well, the reason I'm asking is because sometimes my father suffers from that. His legs will swell up, and then sometimes they won't.
Correct.
And he'll go to the doctor, and they'll do something to him, and then he's back to normal for a long time. So very good. I've learned something, and we just got started. That is fantastic. Vascular disease. Now, people who are having problems, and it's not just in the legs, of course, but I a lot of times think of the legs when I think of vascular disease. It has a lot to do with blood circulation?
Correct. So it's basically anywhere where the blood travels except for the heart and inside of the brain. So neurosurgeons take care of blood vessels inside of the brain. Cardiologists and cardiothoracic surgeons take care of blood vessels that are, in the heart. Right. And vascular surgeons do everything else. Well, so we take care of blood vessels in your neck. We take care of blood vessels in your chest, in your abdomen, in your arms, in your legs, all of the blood vessels that feed your gut, your kidneys.
Wow.
And basically two different types of diseases that go with that, being diseases that clog up the arteries, clog up the circulation, and diseases that cause the blood vessels to expand, more commonly known as aneurysms.
An aneurysm.
Correct.
And people die from an aneurysm.
Oh, absolutely. The concept of an aneurysm is when a blood vessel increases in diameter by twofold, meaning it's double the size of a normal blood vessel. So depending on where you are in the body, the normal blood vessel would be a certain size. When that blood vessel, because the wall begins to deteriorate and weakens, very similar to a balloon, as it expands, it can pop. And so there are aneurysms that occur in the carotid arteries, which are in the neck. There are aneurysms which occur in the aorta, in the thoracic aorta in your chest. The most common aneurysms are the abdominal aortic aneurysms, which occur in the abdomen. You can get aneurysms in your legs as well, so they can occur everywhere.
And that is or could be fatal.
Correct. Absolutely.
We've got a lot to talk about, a lot to cover today. I'm excited about you being here. I've got a lot of questions for you. I have been to a vascular surgeon, and so I've got a little something that is going on with me. I'm going to ask you about that. So we're going to have a good visit.
Excellent.
That sounds good to me. We'll be right back. We're going to take a quick break here on Health for Life. Stay with us, and we'll be right back.
If you're in need of medical care, don't delay. Your health won't wait. Hamilton Medical Center is ready to care for you. We are following CDC guidelines. Patients and guests are screened for COVID-19 symptoms. Those who are suspected to have the virus are treated in a separate area. Plus, Hamilton's high-powered UV light robots eliminate 99.9% of bacteria and viruses on surfaces. Please do not delay medical care. Your health won't wait. As always, Hamilton is here for you.
And we're back on Health for Life, talking with Dr. Dourron from Hamilton Vascular Center. Great to have you in Murray County.
Thank you.
That is fantastic, and that is a community there that is really growing. Murray County is a great place to live. I've got a lot of friends there, and it's great that you guys are there. I think that's wonderful. We've learned about vascular disease. There are some people that are more at risk for vascular disease. Is that correct?
Absolutely.
What are some of the risk factors?
Essentially, the older you get, you're going to get some degree of vascular disease. And so there are obviously certain risk factors that will accelerate that process. The four big ones that we primarily focus in on are high blood pressure, diabetes, cholesterol, and smoking. So if you've got any...
Well, I've got two of those, so I understand.
If you've got any or all of those, then you're going to have peripheral disease or vascular disease in general.
Okay.
Be it peripheral vascular disease, aortic aneurysms, carotid disease. Anywhere where the blood flows in your body, you are going to get disease. And that includes in the heart. For example, if you have heart disease, meaning your coronary arteries are clogged up,
right,
I can guarantee you've got vascular disease elsewhere. Whether it's giving you symptoms or not is a different story. But anywhere the blood travels, you're going to get that damage to the blood vessel, and that will cause the vascular disease. Obviously, age has a lot to do with it as well. And then there's, hereditary components as well. So this does run in families.
What about diet?
Diet, again, basically high-fat diets when you're dealing with glucose, so in other words, diabetics.
Right.
Those are the big, precursors to vascular disease. You want to keep a low-fat diet. You want to keep blood sugars in check, keep your blood pressure in check. And again, the biggest thing that I see on a daily basis is cigarettes. And that's the one thing that unfortunately, as I counsel people on smoking cessation, you have to understand that even if you quit smoking, you've done some form of damage to the blood vessels already, and that does not repair itself. So in other words, for example, if you quit smoking, after a certain amount of time, your risk of lung cancer decreases dramatically. Unfortunately, with the blood vessels, it doesn't work that way. So in other words, the damage that was done even in your youth will come back to get you when you're older because the damage has been done.
I understand. Now, when you talk about cholesterol, we're talking about plaque a lot of times?
Correct. So plaque is essentially a combination of cholesterol, macrophages, other components of the blood that basically form a nidus inside the blood vessel, which will continue to grow until it eventually cuts off the circulation downstream.
A lot of people suffer heart attacks because of that.
Correct.
And if you have had a heart attack or heart disease, as you mentioned, more than likely you've got.
Correct. You've got some form of vascular disease. And oftentimes, I'll tell you, Bobby, we prefer for people to come and get screened or find out what their level of vascular disease is before it causes problems. You don't want to show up in the emergency room with, a blue leg because you don't have circulation to it. You would have much rather have caught it earlier, knowing that you had coronary disease, come in and see the vascular surgeon, get some screening tests done, which are very simple ultrasound tests that we do to measure blood flow. and then that gives us an idea of what kind of risk you are for subsequent disease.
Now, people that are listening, what are some of the symptoms that people should be looking for if they suspect they may have vascular disease?
Yeah, so the one of the more popular symptoms that we see in the office is obviously leg pain. People come in and they describe what we refer to as claudication, which is cramping in your calves as you walk, weakness in your legs. And that oftentimes can get confused with back problems as well. And so people who have bad backs, they come in with leg pain as well. And then it's up to us to differentiate whether that pain in their legs is due to the lumbosacral spine problems or is it vascular disease.
Wow, my goodness. So people with pains in their legs, they definitely need to go see you.
Correct. Pain in the legs, swelling, obviously, is we earlier had talked about lymphatics and lymphedema. Vascular disease also takes care of veins and varicose veins, and that is a hereditary disease. And that also generally presents with leg swelling. Oftentimes it can be painful. However, the pain that comes with varicose veins generally occurs towards the end of the day or at night, whereas the pain that occurs in your legs from lack of arterial circulation generally occurs while you're walking. So oftentimes people will notice, well, I used to be able to walk all the way to the mailbox and back without any pain in my legs, and now I can walk halfway to the mailbox and I've got to stop, or I'm in the grocery store shopping and I can't make it through the entire grocery store without having to stop because I get cramps in my legs. Those cramps, as I stop, then they get better and I'm able to continue. That is what we refer to as classic claudication, which is the name for that type of pain, and it describes to us lack of circulation.
Well, is this a lot of times in your calves?
Correct. Most times it's in your calves. Depending on the level of where the blockages are, it can occur higher. So blood vessels in your trunk area are obviously bigger than the blood vessels lower down in your legs. When you have blockages, for example, in the blood vessels in your thigh, you're going to have pain in your calves. When you have blood vessels in the larger arteries of the abdomen, then you're going to get pain in your thigh areas.
I got you.
So it affects the area below where the blockage is.
My goodness. A lot to know. And now, real quick, we're going to take a break in just a moment. One of the things we talked about in our last segment, and you are a surgeon, you went through general surgery before this.
Correct. We do 5 years of general surgery training, and then I did an additional 2 years subspecialty in vascular surgery.
Is that right?
Mm-hmm.
That is fascinating. You've seen everything.
Yep.
Seen absolutely everything. We're going to take a break. When we come back, we're going to find out how testing is performed for vascular disease. Don't go away.
Do you know the symptoms of a heart attack? Don't ignore symptoms like pain or discomfort in your chest, arms, back, neck, or jaw, or shortness of breath or nausea. Call 911 immediately if you think you or someone you're with is having a heart attack. Seconds count during a heart attack. Trust your heart to the hospital that is #1 in Dalton, Chattanooga, and Cleveland for interventional coronary care. Hamilton Medical Center. Health for life.
Welcome back to Health for Life. Talking with Dr. Dourron from Hamilton Vascular Center, Hamilton Physician Group, Murray County. And we're talking about vascular disease. One of the tests, or what are the tests to find out if you have peripheral vascular disease? What's some of the testing that you do?
So physical exam is a big part of determining whether someone has vascular disease or not. Most people, for example, when you go in to see your doctor, you'll see them feeling for pulses in your feet, pulses in your arms. Those are to see if we are able to feel the circulation in your legs. Most people who have peripheral vascular disease or vascular disease in general, which is where their arteries are clogged up, you won't be able to feel pulses in their feet. So in other words, we have to rely on other mechanisms to measure the blood flow in their legs.
Would that be like an ultrasound?
Correct. So we do ultrasound tests. Our office runs a vascular lab is what we call it, and we have specialized ultrasound techs that do an array of vascular studies. with ultrasound, which is, non-invasive. So in other words, it's basically like just putting a probe over your skin with gel. And what they're able to do is they're able to look inside of your leg, look at the blood vessel. They're able to look at the contours of the blood vessel to see if there's any irregularities in it.
Right.
And they're actually able to measure the speed of the blood going through your blood vessel, which to us is very important because it gives us a determination as to whether or to what degree of blockage you might have in your legs, or in your abdomen, or in your carotid arteries. So these ultrasound tests are able to be done pretty much all over where we operate.
Now, when you're checking for this, you're talking about the speed of the blood as it goes through?
Correct.
That is fascinating.
Yeah, they're actually able to see how quickly blood goes through. And a good analogy to this, think of a water hose. For example, whenever you turn on a water hose, the water is coming out at a certain rate.
Mm-hmm.
Well, as you put your thumb over the end of that water hose, what happens to the water?
The
water goes out quicker.
That's
it shoots
right.
out further and it goes out quicker.
Yep.
So that is essentially a blockage in the artery.
So
when you put your thumb over that hose,
got you.
That's
the plaque.
That's the plaque.
Okay.
And you're actually having to make that blood travel faster through there in order to get through. And so that ultrasound exam is actually able to detect that increase in velocity of the blood, meaning it goes quicker through that area, and then we can quantify that into a certain percentage of blockage. Understand that not all blockages require surgery. So I am a vascular surgeon. However, I would tell you that the majority of the people that I treat, I do not operate on. And so we treat people without having to do surgery on them until the very end where surgery is required. And so surgery, when you come see a vascular surgeon, doesn't mean you need surgery, doesn't mean you're going to get surgery. Oftentimes we're able to treat people without surgery to improve their situation.
And that's by medication, by oral medication.
With medication, with counseling as far as smoking cessation,
right?
Walking programs. So in other words, just walking, a regimented walking program will do wonders for people who have early onset vascular disease. Then there are certain medications that can improve blood flow.
What are some of those medications?
So there's two primarily that we talk about as far as improving blood flow, and those are Trintol and Platol. Those drugs, what they help do is help form what's called collateral circulation. So in other words, if I have a blockage, a collateral blood vessel is a blood vessel that will develop to go around the area of blockage. A good analogy that I use for people is to think of it as an expressway and side streets. So in other words, your blood vessel is the expressway. Well, if there's an accident on the expressway, then traffic goes through the side roads to get around. Gotcha. That's the exact same thing that's happening with collateral circulation. You've blocked up the expressway, which is the main preferred route to get there, but you can still get there through collaterals.
Now, would you sometimes maybe feel some numbing sensation there, or like it's going to sleep where you're not getting good flow?
Correct, and that's another sign. So people lose sensation to their legs, but also that can also be confused in diabetics with neuropathy. So in other words, people who have diabetes, they also get nerve damage and oftentimes come in with numb feet, and that can also be a sign of vascular disease. Hair loss on your legs is another sign. People, men in particular, who, they start losing their hair on their legs is a sign that they may not be getting enough circulation to their legs.
Would that be they're not getting enough blood flow for the hair to grow?
Correct.
Wow.
Absolutely.
That is something. Such good information today. We're going to take a short break. When we come back, we're going to talk about varicose veins and the treatment that is offered for them at Hamilton Vascular Center.
Do you know the symptoms of a heart attack? Don't ignore symptoms like pain or discomfort in your chest, arms, back, neck, or jaw, or shortness of breath or nausea. Call 911 immediately if you think you or someone you're with is having a heart attack. Seconds count during a heart attack. Trust your heart to the hospital that is #1 in Dalton, Chattanooga, and Cleveland for interventional coronary care. Hamilton Medical Center. Health for Life.
Welcome back to Health for Life. We're talking about vascular disease. And one of the questions that I have is that we've all seen or maybe even experienced varicose veins. Some don't know exactly what they are, and I'm speaking from someone who doesn't know exactly what they are. What are varicose veins?
So varicose veins are another not a subspecialty, but a section of vascular surgery that we take care of. Arteries take the blood down to your feet. Veins take the blood back up towards your heart.
Right.
So it's basically the direction of the blood flow. Arteries are generally under high pressure. Veins are under low pressure, generally. People who have varicose veins, and this gets misconstrued a lot because there's a variety of varicose veins, to the point that nowadays the new nomenclature of this, we refer to it as venous insufficiency. And venous insufficiency essentially encompasses a lot of different things. So oftentimes I'll have patients come into my office and I'm looking at their legs and I say, oh, you've got varicose veins. And they're like, oh, no, I don't have varicose veins. I knew someone who had varicose veins. They were those big, ropey, bulging veins that people often see.
Right.
That's not the only kind of varicose veins that there are. So varicose veins have a different, depending on how long they've been around, how long your disease has progressed, they can get worse or not. Some people have just these little faint blue lines underneath the skin. We call those telangiectasias. And essentially it is a varicose vein. It's a form of varicose vein. It's a very small varicose vein. But the reason that you're able to see those varicose veins is because they're under tremendous pressure. Remember earlier, Bobby, I told you that venous system is a very low-pressured system. Mm-hmm. So if, for whatever reason, the veins become pressurized, then you will start to get development of those telangiectasias, which then develop into spider veins.
Well, I was going to ask you about spider veins because I've heard
spider
a lot about those.
Don't mean you get bit by a spider.
No.
It is a slightly larger vein than a telangiectasia.
Gotcha. And they're on the surface sometimes of the skin.
Correct. Absolutely.
You can see that. Okay.
You see them. Those progress over time, and that's the one thing that you need to understand is varicose veins. First of all, let's back up. It's a hereditary problem. People are born with it. Their mom or their dad had it. Their grandmother had it. They've given it to their kids, and so on and so forth. It's a disease that does not go away.
So they're born with it.
They're born with it. They don't develop it until they're older, and that's
why you don't see it in kids.
That's the caveat.
Yes, I understand.
Sometimes as a vascular surgeon, I do see girls as young as 18, 20 that will come and see me for varicose veins.
Wow.
So that is obviously an early presentation, but as you'll see in their history, they have a strong family history of that. But it is all hereditary, and so in other words, you cannot cure varicose veins. You can treat it, but there's no cure for it because it affects all of the veins in your legs. There's a variety of treatments that we do perform. You have to understand, however, that varicose veins, the older you get, the more you're on your feet, the worse it gets. And so people will say, oh, well, I've never had this problem until now. Well, yeah, you've always had this problem. You've just now started to notice it, and it's just now started to become more symptomatic. However, you've always had it because it is hereditary. Oftentimes people will say, well, I was working in the factory and I've been on concrete the entire time, and that's why I got varicose veins. Incorrect. You got varicose veins because it's a hereditary problem. Certainly standing on your feet on concrete all day long doesn't make it any better. Right. However, it didn't cause it.
It's hereditary.
Correct.
It is hereditary. What is the treatment? What is the treatment for varicose veins?
So generally we diagnose varicose veins clinically. So in other words, you can just see them on the skin, and once you see them, then you know that they have varicose veins. There are two vein systems in your leg. There's a superficial vein system and a deep vein system. The superficial vein system is primarily where people get varicose veins from. So in other words, it's part of the superficial vein system. Mm-hmm. The deep vein system is deep within the muscles. So the treatment of these varicose veins is what we call compression therapy. So in other words, what we do is we give them graduated compression stockings. Now, these are not just tight stockings. These are specifically designed to squeeze with a certain amount of intensity. They squeeze more at the feet than they do up in the upper calf. These socks generally will go from just below the knee to thigh or even pantyhose style, and they will collapse the superficial vein system, and they force the blood to go up through the deep vein system. The deep vein system is deep within your muscles, and every time you're walking, your muscles are actively pumping that blood out of your veins and back up towards your heart.
Right.
Now, the other component to this that we also take care of, remember I've discussed with you the superficial vein system, and the reason for that is that it connects to the deep vein system. Well, the vein, where the two vein systems connect, there is a valve, a one-way valve, essentially. And blood that is in your veins is supposed to travel from your feet up towards your heart. So all veins have these valves within them, and this is the primary problem with venous insufficiency, is that your valves are not working properly. And so think of it as a tube with a valve that goes one way. So in other words, blood flow goes through the valve, it opens up the valve, and then the valve is supposed to close. People who are born with venous insufficiency, they're born with veins that are larger than they should be. Their valves don't meet. So in other words, they have leaky valves.
Gotcha.
That leaky valve is what causes increased pressure in their vein systems, because now instead of being able to divide the veins into short segments with low pressure, now you've got this big giant column of blood from your heart all the way down to your feet that's not divided by these valves. And so that's what causes the increased pressure. Well, where the two vein systems come together, it's up in the groin area. It's called the saphenofemoral junction, and there's a large valve there. When that large valve is not working properly, then people get something that we refer to as reflux. Similar to reflux in the stomach, where more people, I think, are more familiar with reflux in the stomach, where you basically get acid that, regurgitates.
It comes back up, sure.
And it gives you that burning feeling.
Right.
So this is essentially reflux in the veins. So remember, the arteries take the blood down to your feet. The veins take the blood back up towards your heart. Well, imagine if one of these valves is not working properly, and particularly the one that separates the superficial venous system from the deep venous system, then you get reflux, which is blood will actually travel backwards in that vein.
Oh, no.
So when blood travels backwards in that vein, that also contributes to the increase in pressure in the venous system. Remember that the venous system is supposed to be a very low-pressured system.
Right.
So by increasing the pressure, then that's what causes these veins to show up on your skin.
This is all great information, Dr. Dourron. Thank you so much for joining us today.
Well, thanks for having me, Bobby.
For more information or an appointment at Hamilton Vascular Center in Dalton, call 706-259-3336. For an appointment at their Chatsworth office, 706-686-8090. You can also visit hamiltonhealth.com/vascular to learn more. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System. Be a hero. Stop a stroke. If you think someone you're with is having a stroke, ask him to smile. Does his face droop? Have him raise both arms. Does one arm drift down? Can he repeat a simple phrase without slurring? If you see even one of these symptoms, call 911 right away. Because when it's a stroke, every second counts. Hamilton Medical Center has a nationally ranked, highly trained rapid stroke team ready to care for you. Hamilton Medical Center. Health for life.
Do you snore? Are you always tired? You could be suffering from obstructive sleep apnea. Hamilton Regional Sleep Center provides real solutions for sleep apnea, insomnia, narcolepsy, and restless leg syndrome. Overnight sleep testing is conducted by highly trained technologists in a warm and friendly environment. Call Hamilton Regional Sleep Center, 706-278-4757. That's 706-278-4757. Did you know that colon cancer claims over 50,000 lives each year? The good news is that colonoscopies save lives. Convenient appointments are available at Hamilton Medical Center's new Bandy Endoscopy Center, located at the corner of Broderick and Memorial Drives. Hamilton follows CDC guidelines and screens for COVID-19 symptoms at the door. If you are age 50 or older or have a family history of colon cancer, ask your primary care provider to schedule your colonoscopy. Please don't delay important medical screenings. Your health won't wait.